What are the complications of fibroid? There are degenerations, necrosis, infection, sarcomatous changes, and torsion of subserous peduncular fibroids.
वेरी गुड. एनीमिया भी है.
और पॉलीसिंथेमिया.
चलो, नाउ योर टर्न.
Define uterine fibroids.
The most common benign tumor of female, which is composed of smooth muscles and fibrous tissue.
वेरी गुड. हाँ, नाउ योर टर्न.
Write down investigation of uterine fibroid. Investigations aims at first to confirm the diagnosis, and second is to preoperative assessment. So first, to confirm diagnosis, there are various methods to confirm the diagnosis of uterine fibroid. The first one is ultrasound and color Doppler findings. Then second is a 3-dimensional ultrasounds. Then third one is a saline infusion sonography. Then magnetic resonance image, which is MRI, and then laparoscopy and hysteroscopy. These are the investigations
to diagnose uterine fibroid.
Okay. Then second one is a preoperative assessment. Apart from the routine investigations, there another is intravenous pyelography to note the anatomical changes in uterus.
Preoperative investigations means if we are thinking about the operative measures, so it is a part of line of treatment. Okay.
It's helpful to
manage
the anatomical changes in uterine.
Now ask.
Next question. Risk factor of the uterine increase.
She is asking risk factor of uterine fibroid.
Increasing age, nulliparity, and early menarche.
Increasing age.
Increasing and high dosing. Risk factors में nulliparity, obesity, high body mass index, और black woman,
Hyperestrogen history,
family history,
increased BMI, PCOS.
Very good.
And reduced risk factors are multiparity, contraceptive and menopause.
Smoking. Okay, interesting. So reducing factor, smoking. Okay. Now your turn.
What are differential diagnosis of uterine fibroid?
What are the
Differential diagnosis of uterine fibroid.
It's differential diagnosis.
The factors of the urinary sizes vary. Urinary be confused with pregnancy, bladder, adenomyosis, myohyperplasia, ovarian tumor, tumors.
What do you mean by adenomyosis? Anybody from you? Adenomyosis should be differentiating from uterine fibroid. Okay. So what do you mean by adenomyosis? It is endometriosis and tissue invert into myometrium. म्हणजे ectopic endometrium growth आहे ना, त्याला जेव्हा मायोमेट्रियममध्ये जाते ना तिला म्हणतात ॲडेनोमायोसिस. त्यामुळे त्याच्यामध्ये पण एक प्रकारचं सोलन आहे ना जसे फायब्रॉइडमध्ये होतं, परंतु ते आणि ते याच्यामध्ये डिफरन्शिएटिंग कॅरेक्टर्स क्रिएट होणार. दिसायला ते तसंच राहणार, ब्लिडिंग वगैरे एक्सेस असणार. ठीक आहे. नो युअर टर्न.
What are the types of uterine fibroids present in the body and cervical region? Explain it in brief.
Ask hard questions. Types of uterine fibroid.
Body and cervix. Body and cervix. Body has three types: interstitial or intramural. Then second in subserous. And third is submucous.
Sakshi.
Interstitial tumors are 75%. Then submucous tumors are intramural tumors which are pushed outside of the peritoneum, and it also contains pedunculated submucous tumors. And subserous tumors are the tumors which are intramural tumors which are pushed inwards. It also contains subserous pedunculated tumors. And in body or cervical region there are pseudocervical tumors.
Okay. Now your turn.
Composition of fibroid tumor. Can you repeat the question, please?
Composition of
Composition of fibroid tumor. Smooth muscles plus and fibroid connective tissue.
very good. Fibrous connective tissue and smooth muscles. Very good. Now your turn.
Which is the most common type of uterine fibroid?
Body.
Interstitial or intramural. है ना, most common uterine fibroid, that is near about 75%. Your turn.
What is the role of polypeptide growth factor in the fibroid?
What is?
The role of polypeptide growth factor in fibroid. The epidermal growth factor, insulin-like growth factor, transformative growth factor, stimulate the growth of the neomyoma either directly via estrogen.
Very good. Now your turn.
Next question. What is the pseudo-cervical fibroid?
Pseudo-cervical fibroid म्हणजे काय?
Fibroid
Hmm?
be arising from the uterine body when it occupies and distend the cervical canal.
Canal.
It's called as pseudocervical.
Fibroid. Okay. Now your turn.
What is a broad ligament?
What is the?
Broad ligament.
Broad ligament. Fibroid में. अच्छा. हाँ.
Sometimes the intramural fibroid may be pushed out in between the layers of broad ligament and it is called as the broad ligaments.
Your turn.
Explain the pathology of uterine fibroids. Naked
Arising from the uterine body when it occupies and distend the cervical canal.
Canal.
It's called as pseudocervical.
Fibroid. Okay. Now your turn.
What is a broad ligament?
What is the?
Broad ligament.
Broad ligament. Fibroid में. अच्छा. हाँ.
Sometimes the intramural fibroid may be pushed out in between the layers of broad ligament and it is called as the broad ligaments.
Your turn.
Explain the pathology of uterine fibroids. Naked appearance. Due to uterus and fibroid, there is distension of the abdomen and abdomen is enlarged. The cut surface shows smooth and whitish color. The central part of the uterine fibroid is vascular and
No degeneration.
there is no degenerative changes.
Peripheral ला पेलर असते.
And there are blood vessels found in supply to the tubule.
Okay. Your turn.
And it also contains smooth muscles and fibrous connective. What is womb stone? Defined it.
Womb stone. Okay.
When the whole tumor is converted into calcified mass,
Very good.
then it is called as a womb stone.
Degenerative change है. Huh? It is a degenerative, calcifying degenerative change. Okay. It is like no hard stone. White hard stone. Hence it is named as a womb stone. Okay. Now your turn.
Nomenclature of fibroid should be called as
Fibromyoma or myoma.
Your turn.
What are causes of symmetrical enlargement of uterus?
Oh.
Pregnancy,
हाँ.
fibroid,
Hmm.
adenomyosis, myohypoplasia.
हां. मग अशी डिफरन्शिएटिंग सांगितलं ना ॲडिनोमायोसिस सिमेट्रिकल ग्रोथ होते याच्यामध्ये है ना आणि फायब्रोमध्ये मध्ये थोडीशी इरेग्युलर असते शेप है ना प्रेग्नन्सीमध्ये सुद्धा युनिफॉर्मिटी असते है ना म्हणजे युनिफॉर्मिटी ग्रोथ कशात होते
Myomera, hematuria, leukemia and malignancy.
ओके युअर टर्न
Explain secondary change in fibroid.
सेकंडरी चेंजेस ऑफ युटराइन फायब्रॉइड
Number one, hyaline degeneration, then cystic degeneration, fatty degeneration, red degeneration, calcific degeneration. Then other are atrophy, necrosis, infection, vascular changes or sarcomatous changes.
and anemia too. Okay, your turn.
Drugs used to minimize the blood loss.
Drugs?
Drugs used to minimize blood loss.
हाँ, okay, drugs.
The drugs which are used to minimize the blood loss There's a dinazole, antiprogesterones, then antagonists and antagonists.
Because our first line of the expected management that you have to stop the loss of bleeding and recorrect the bleeding, है ना? Actually it should be it is asking homeopathic point of view, but you should know. ओके डायनासिलमुळे काय होते की मेन्स्ट्रुएशन्स अरेस्ट होतात, एमेनोरिया होतो, क्रिएट आणि एस. ओके ओके, नाउ युअर टर्न.
What are the clinical features of uterine fibroids?
Clinical features.
In clinical features, the patient profile, the patient is nulli parous.
Very good.
Secondary infertility. The age of the patient is between 55 to 45 years. And symptoms are, she has menorrhagia, metrorrhagia, enlarged abdomen,
Dysmenorrhea too.
dysmenorrhea, and there is a fertility. Abdominal enlargement.
हाँ, distension. It depends upon, है ना. Up to 14th week it is not possible. 12 to 14th week we are not looking for the distension abdomen, but afterward the abdomen can be distended. Okay. And vaginal discharges, है ना, due to congestion, pelvic pain, difficult locomotion, difficult in standing, urinary complaints. Okay. Yes. Low backache. Because fibroid compresses spine, है ना, sacral level, time to time it compresses, है ना. Hence low backache is also along with uterine fibroid. Okay, your turn.
Then about any two therapeutic drugs
Any two. Okay, for
for uterine fibroid.
So there are many drugs, but some of them are calcarea carb, natrium mur, puja, then sebina, iodine, and then phosphorus, silicia, and calcarea carb. Sorry, calcarea phos, and lycopodium.
Okay.
These are the drugs.
Okay, your turn.
Okay. What are the signs and a pelvic examination found during explaining uterine fibroid? Signs.
What are the signs? She is asking about if there is uterine fibroid. What signs? Okay.
It is felt per abdomen. After 14th week, we can feel palpation in which the leg pain is present.
Because it is a solid mass, है ना?
The margins of the tumor are well defined, nodular.
अरे mobility very good.
Above downward, but can be moved back from
Side to side. Mobility is present, positive. Okay. Anything else?
Bright red area.
Signs? Per vaginal signs? Per speculum, per vaginal?
Uterus is not well separated from the
Se-
cervix. Then cervix moves with the movement of the uterus.
Painful. On touching it is painful too. Okay? Very good. Now your turn. Any? One more important thing that you forgot, symptomatic and asymptomatic management. Okay? And it was very nice discussion. Both of the groups very nicely prepared. Very good.